For 3 years, a plain yellow flag fluttered atop this hill. The flag bore no imagery. It implied no political agenda. It symbolized only hope and solace. The army that toiled beneath that flag carried not guns, but bandages, medicines, and food. It dispensed not death, but healing. It included not just uniformed young white men, but also women, civilians, slaves, and free blacks. The yellow flag was, during the Civil War, an emblem of a military hospital. It flew over hospitals of all sorts, from field hospitals only miles from the front lines to the huge general hospitals in cities far removed from the battlefields. Here on this hill in Richmond, the yellow flag flew over one of the largest military hospitals in the Confederacy, Chimborazo. With 150 whitewashed wooden buildings, 30 tents, and 3,000 beds, Chimborazo stood at the apex of a Confederate medical organization that struggled to keep pace with the flood of wounded and sick soldiers that poured in from the armies in the field. Nearly 50 other hospitals operated in Richmond during the war. A soldier's road to Richmond and Chimborazo often started near the front lines. In 1861, military camps suddenly abounded across the Confederacy. Country boys found themselves in close quarters with impure water, poor food, and little attention to cleanliness. General Robert E. Lee lamented his soldiers' hygiene. "They are worse than children," he said, "for the children can be forced to clean." Common childhood diseases like measles and mumps, as well as acute and chronic diarrhea, ravaged the camps.
When we were on the Chickahominy in 1862, we sent from 5 to 12 men to the hospital each day. I trust we will be exposed to no greater danger in the future than bullets, for they do not compare in destructiveness to disease. Captain Hunt's company lost 7 men from battle and 25 from disease, and in most companies, the difference was greater than that. Dr. Spencer Glasgow Welsh, 13th South Carolina Infantry.
Surgeons in the field spent most of their time treating men who appeared at sick call each day. These soldiers usually had illnesses and minor injuries of the sort the doctors had encountered routinely before the war. But with war, these common diseases and injuries came in huge volume. More than 850,000 Confederate soldiers reported at sick call during the war, more than a quarter of them with dysentery or diarrhea. More than 36 medicines were available to the doctors. Only a few, such as quinine, were effective, and many did more harm than good. Without knowledge of microbes or antibiotics, doctors could do little beyond encouraging the body's natural healing process. That often was not enough. During the Civil War, sickness killed twice as many Confederates as did Union bullets and cannonballs. Each year, battle consumed just a few days of a soldier's or surgeon's life. But to the public, those few days came to define Civil War medicine. 75,000 Confederate soldiers fell wounded on battlefields within 90 miles of Richmond. Wounds to the arms and legs were most common and had the best chance of survival. Wounds to the torso and vital organs were usually fatal. Surgeons and attendants did what they could to comfort the fatally wounded, but directed most of their efforts to those they could hope to save. To treat the flood of wounded, surgeons commandeered homes, set up tents, or sometimes worked out in the open, as near the front lines as safety permitted. A Confederate newspaperman at 2nd Manassas reported,
"The wounded were lying upon the ground, awaiting their turn with patience. Some dead, some dying, but the great majority with painful wounds in the extremities. The operating tables were slimy with blood, and as fast as one patient was removed, another took his place, to be anesthetized by the merciful chloroform. The men all appeared to bear their wounds cheerfully."
Before the war, many surgeons had never seen a gunshot wound. Now they treated them by the hundreds, even thousands. They often operated to the point of total exhaustion. Those soldiers with wounds that fractured arms or legs usually faced amputation. Doctors eventually learned that the sooner they performed the amputation, the greater the chance the soldier had to survive. Of those operations performed within 24 hours of the wounding, 73% of the patients recovered. Almost always, such operations were done with anesthesia, chloroform, or ether. Faced with difficult decisions under horrid conditions, the vast majority of the surgeons were careful and precise about their work. Most took about 5 minutes to complete an amputation. Patients awoke almost immediately. After the operation, the wounds were carefully dressed. It was not common knowledge in the 1860s that bacteria caused infection, and the failure to sterilize instruments and bandages was a primary reason that nearly all wounds became infected. Although the surgeons were powerless to prevent infection that killed many, they saved tens of thousands of lives by their work. Still, battle rendered tens of thousands disabled for life. Perhaps more than anything else, the realities of medicine in the field exploded many a soldier's idyllic view of war. While some men went to war imagining, at worst, a death shrouded in glory on the battlefield, few foresaw the intense anonymous suffering so common in field hospitals. After a battle, every home, barn, and shed within a 5-mile radius was used to shelter and treat the wounded. A returning civilian found the Watt House on the Gaines Mill battlefield transformed after the battle.
Even in the yard there were graves. And the floors? From attic to cellar, there was scarcely a space of flooring as large as a man's hand that did not bear the dark purple stain of blood. Mary Jane Haw, granddaughter of Sarah Watt.
Following the evacuation of the wounded, a servant at the nearby Adams house remembered the huge cleanup of blood-soaked household items.
After the battle, all the houses and other buildings on the place were used for a hospital. The beds had to be buried. I dug a hole with my own hands and buried 4 feather beds, and the bed clothing, the sheets, blankets, quilts, and pillows, all were soaked in human blood. Maria Robinson, Adams' family servant.
After giving care at the front, be it for disease or wounds, the field surgeons promptly evacuated patients to general hospitals farther to the rear. By far the largest collection of such hospitals was in Richmond, Virginia's dominant rail center. And the hospital that treated the most patients in Richmond was Chimborazo. The journey here came in 2 forms, along one of the many railroads that radiated from Richmond across the Confederacy, or, if close enough to Richmond, by ambulance or wagon. Confederate General John M. Bowdoin recalled the plight of the wounded in one such ambulance train.
Very few of the wagons had even a layer of straw in them, and all without springs. The road was rough and rocky. The jolting was enough to have killed strong men, if long exposed to it. From nearly every wagon came cries and shrieks. "Oh God, why can't I die? Stop. Oh, for God's sake, stop. Take me out and leave me to die on the roadside."
Soldiers arriving at Chimborazo found a clean, state-of-the-art facility, vastly different from the field hospitals. Its buildings were evenly spaced to allow air circulation between and through the wards. It had its own bakery, which produced up to 10,000 loaves of bread each day. There was a bathhouse, brewery, laundries, kitchens, and a herd of both cattle and goats. Chimborazo even had its own canal boat, which hauled produce along the James River and Kanawha Canal to feed troops convalescing here. 76,000 men passed through Chimborazo, many with horrid wounds or debilitating illnesses. More than 80% recovered, either to return to the Army or to their home. With most white males serving in the armies, women, slaves, and free blacks stepped in to fill medical roles traditionally occupied by men. More than 400 blacks, both slave and free, worked at Chimborazo as nurses, cooks, laundresses, and laborers. An 1862 visitor noted that 2 or 3 black nurses worked in each of Chimborazo's buildings. The presence of African Americans in the workforce was common in the pre-war South. The presence of white women in the workforce was not. The appearance of women at Chimborazo stimulated hostility from some. Phoebe Yates Pember of South Carolina remembered her first day on the job.
Those who accepted with horror the advent of female supervision walked in and out, evidently inspecting me. There was no mistaking the stage whisper which reached my ears from the open door of the office that morning, as the little contract surgeon passed out and informed a friend he met in a tone of ill-concealed disgust that one of them had come.
Unlike the North, the Confederacy never developed a formal training program for nurses. Instead, nurses, matrons, and attendants, black and white, male and female, learned on the job. Although Chimborazo provided the best care possible for a hospital of its size, it was common knowledge in Confederate ranks that more personalized care could be had at one of the smaller hospitals scattered throughout Richmond. Maria Clopton financed and opened a 45-bed hospital in her own home on Franklin Street. The Nuns of St. Francis ran a 30-bed facility on Brook Avenue that cared for both Union and Confederate soldiers. So respected were the nuns that Federals and Confederates allowed them to pass freely between the lines, their religious habits serving as their only identification. Of all the private hospitals in Richmond, none gained more fame than the Robertson Hospital at 3rd and Main Streets. Sally Louise Tompkins opened the Robertson Hospital with her own funds in August 1861. When the Confederate government sought to transfer all private hospitals to the military, Miss Tompkins objected. President Davis intervened and solved the problem by making Sally Tompkins a captain of cavalry. Though she never accepted payment for her position, Captain Sally Tompkins was the only woman to receive a Confederate commission during the war. Between August 1861 and April 15, 1865, more than 1,300 soldiers passed through the doors of her hospital. Out of these, only 73 died. Nurses and matrons did more than tend to the physical needs of the wounded. They often found themselves faced with excruciating emotional tasks.
Chimborazo Hospital, Richmond, July 1864. My dear sir, I feel the sincere sympathy for you in the loss of your noble son. I wish that you could have been with him. It would have been a comfort to him, and you would have had the satisfaction of knowing and seeing for yourself that he received every attention. He wanted for nothing except to see you. I pray the best of all consolations may be yours in your distress. With sympathy, I am respectfully, Mary E. Rowland, matron at Chimborazo.
The presence of hospitals in Richmond meant, too, that death was ever present. About 8,000 men died at Chimborazo during the war, an average of 5 each day. Many more died at other hospitals. Clattering wagons carrying the dead to the city's cemeteries were as common as milk deliveries. Most of Chimborazo's dead are among the 16,000 Confederates buried at Oakwood Cemetery. The Confederacy collapsed by increments in 1864 and 1865, but the Confederate Medical Service remained effective until the end, and its legacy extended for generations beyond the conflict. The large Confederate mobile hospitals that followed the armies foreshadowed 20th century hospital units such as MASH. During the war, Southern women took their first significant steps into the workforce. Their presence would increase steadily over the next century. Thousands of doctors trained in the cauldron of war under the yellow flag and then returned home to serve the residents of small Southern towns for decades. Many former Confederate physicians helped create and even run state and local boards of health after the war. putting to use the hard wartime lessons learned about cleanliness. But most importantly, hundreds of thousands of men treated at field hospitals or brought back to health at places like Chimborazo returned to their homes to rebuild the South after the war. Their very survival was testimony to the immense efforts of thousands who toiled under the yellow flag, men and women, soldiers and civilians, slave and free.